Have you ever felt like your knee pain gets better for a few days, and then suddenly comes right back? Sometimes you rest, avoid certain movements, even feel a bit of relief, but all it takes is climbing stairs or walking a little more, and your knee starts complaining again. And that gets exhausting, because it feels like you're always ending up in the same place, like your knee never truly gets better. And this is exactly where a lot of people get it wrong. Because most of the time, the problem isn't just the pain coming back. It's that there's a very common mistake in how you're using your knee. And that mistake keeps the overload happening, even when everything seems fine. And today, I'm going to show you what that number one mistake is. Plus, what to do instead so your knee can finally break out of this cycle. Stick with me until the end, because I'll also show you a simple adjustment that can significantly reduce pressure on your knee in your daily routine. And almost nobody pays attention to this. Before I show you the mistake, let me explain something important. In clinical practice, one of the most common things I see is this. The pain improves for a few days, and then it comes back. And this doesn't happen by accident. Today, biomechanics has made it clear that the knee doesn't suffer just from load, but from how that load is distributed. The knee joint is built to handle weight, but that weight needs to be properly shared between muscles, the joint, and movement. When that doesn't happen, the load starts concentrating in the same spots over and over again. And scientific studies show exactly that. Misalignment and lack of muscular control change how load is distributed within the knee, increasing stress on specific areas of the joint. And that's where the problem begins. Because cartilage can handle pressure. That's what it's designed for. But when that pressure keeps hitting the same spot repeatedly, without control or proper distribution, the body falls into a cycle. It eases off, you go back to moving the same way, overload builds up, and the pain returns. Has this ever happened to you? If it has, comment yes below so I know. And if you want to better understand what's going on with your knee and learn how to move more safely, subscribe to the channel. Because here, I always share simple, safe, straight-to-the-point exercises, especially for those who want to stay active well into their 50s, 60s, and beyond. Now let's start with mistake number 3. It seems logical, but it actually hurts more than it helps. Avoiding movement to protect the knee. People start avoiding bending, avoiding stairs, avoiding effort, and they may even feel some relief at first. That happens because, by reducing the load for a few days, the joint can indeed become less irritated in that moment. The problem is that this relief is usually temporary. The body works through adaptation. When you reduce the use of a certain area too much, it understands that it no longer needs to maintain that level of readiness. And this directly affects the muscles that protect the knee. With less use, the muscle doesn't just lose strength, it loses control and timing. In other words, it stops activating at the right moment to support movement. And that makes a big difference in practice, because the knee isn't designed to absorb load on its own. It depends on muscular support to better distribute that force. When that support decreases, the load hits the joint more directly. That's why many people notice that after a few days of taking it easy, the knee actually feels more sensitive when they return to normal activities. Another important point is that movement also helps keep the joint functional. When you move, there's a stimulus that improves local circulation and supports the overall function of the joint. When you reduce that stimulus too much, the knee tends to become stiffer, more locked, and less prepared for daily activities. So the problem isn't taking care of yourself. The problem is thinking that stopping everything will fix it. The knee doesn't improve with a lack of movement. It improves with the right movement, done with control, within your limits, and consistently. Mistake 2. Everyday postures that keep the knee under pressure. Now let's move on to mistake number 2. This one is even more subtle because it happens all day long without you noticing. These are everyday postures that seem comfortable but keep the knee in overloaded positions for extended periods. A very common example is sitting with your legs crossed. Another is sitting on top of your own leg, like many people do on the couch or in a chair. There's also the habit of standing with the knee fully locked back, in hyperextension. In these positions, the body may feel relaxed, but that relaxation comes at the cost of poor alignment. When the joint stays in this position for too long, the load stops being well distributed. Instead of passing evenly through the muscles and the joint, it starts to concentrate more in specific areas of the knee. At the same time, some structures remain under constant tension, while others barely participate at all. The issue is that this usually doesn't cause immediate pain. So people keep these habits for hours throughout the day, accumulating small, repeated overloads. And it's this accumulation that over time contributes to that feeling of pressure, discomfort, or pain that shows up without a clear reason. Another important point is that these postures end up teaching the body to organize itself in an inefficient way. In other words, it's not just about when you're standing still. This pattern also starts to influence how you move afterward, whether walking, climbing stairs, or getting up from a chair. That's why the adjustment here is simple, but very powerful. Start paying attention to how you position yourself throughout the day. Avoid staying for long periods with your legs crossed. Avoid sitting on your leg, and when standing, keep your knee slightly relaxed instead of fully locking it back. These small adjustments already change how the load passes through the knee and help break this cycle of continuous overload. Mistake 1. Now let's move on to mistake number 1, and this is the main one of all. Many people believe the problem is only in the cartilage, in wear and tear. But in practice, what most keeps the pain coming back is the knee functioning without enough stability to handle everyday load. The joint does receive body weight, but it doesn't receive it with proper support from the muscles that should be helping to control that movement. And when that support fails, the load stops being well distributed and starts being absorbed in a more concentrated way within the knee. And here's the most common cause behind that: muscle weakness. When muscles like the glutes, the thigh, and the stabilizers of the leg are not strong or well coordinated, the body loses the ability to properly control each movement. This doesn't show up only during exercise. It shows up when walking, climbing stairs, getting up from a chair, in everything. From a biomechanical perspective, the knee depends on these muscles to maintain alignment and control the force passing through the joint. It wasn't designed to work alone. When this musculature doesn't do its job, movement becomes more unstable, more loose, and the load ends up being distributed in a disorganized way. And this is where a key point comes in: the hip. The hip is one of the main structures responsible for providing stability to the leg as a whole. When it's strong and active, it helps maintain alignment during movement. But when it's weak, the knee ends up compensating. And this compensation, even if small, is enough to increase overload over time. The most important thing to understand is that this doesn't happen suddenly. It's something that repeats with every step, every daily movement. That's why the pain doesn't show up as a one-time event, but as a cycle that keeps coming and going. So it's not just about strengthening the knee in isolation. It's about improving the stability of the entire system. And when that stability improves, the body starts distributing load better, and the knee stops being the part that suffers the most in this process. Now look at how everything connects. When knee pain improves for a few days and then comes back, many people think the body has regressed, or that the knee is getting more and more worn out. But in practice, what often happens is something else. The irritation may decrease for a while, but the pattern that created the overload remains the same. In other words, the symptom goes down, but the cause is still there, working in the background. That's why so many people get stuck in this frustrating cycle. Now tell me in the comments, which of these mistakes do you feel is making your knee worse right now? 1, 2, or 3? Drop your answer below. I want to better understand what's going on with you. That's why one of the most important things I want you to take from this video is this: a knee that hurts, improves for a few days, and then hurts again is often not just asking for rest. It's asking for reorganization. It's asking for a body that distributes load better, muscles that participate more, and habits that stop feeding overload throughout the day. These small adjustments already reduce overload throughout the day. And that matters a lot, because the knee doesn't only feel what you do during exercise, It also feels how you position yourself, how you walk, how you sit, and how long you stay in the same positions. Another very important point is movement. The knee needs to move to function better. This movement helps lubricate the joint, improves local circulation, and keeps the tissues more active. When someone stays still for too long, the knee tends to become stiffer, more locked, and less prepared to handle load when they go back to walking, climbing stairs, or getting up from a chair. That's why walking is indeed a good option you can start with. No pain, no overdoing it, but with consistency. You don't need to turn this into an intense workout. Sometimes a light and steady walk helps much more than alternating between days of excess and days of complete rest. The body responds better to consistency than to extremes. But that alone isn't enough. Walking helps, movement helps. But without strength and stability, the knee remains vulnerable. That's why it's also important to strengthen your legs, whether at the gym or at home. It's not about where you do it. It's about training your body to better support the joint. And to start improving this stability, 2 exercises can already make a big difference. The bridge, which activates the glutes and provides more support to the knee, and the standing lateral leg raise, which improves hip control. These 2 exercises target an area that many people neglect, but that has a direct impact on how the knee handles load in daily life. You don't need to do everything at once. Start simple, focus on quality, and respect where you are right now. The most important thing here isn't doing a lot. It's doing it well and often enough for your body to start responding. And if you want to go deeper, here on the channel there are other videos with exercises in different positions, including one with chair exercises you might like. I'll leave it here on the screen. Now let me give you the bonus I promised, because it can really complement everything we've talked about so far. When it comes to the knee, many people think only about exercise, and it really is the foundation. Without proper movement, strengthening, and improved stability, the knee keeps falling into the same overload cycle. But there's another piece that many people overlook, and that can help as a complement. What you provide to the joint through nutrition and, in some cases, supplementation. Cartilage doesn't function in isolation. It depends on the environment around it. That's why when someone combines proper exercise with better habits, the results tend to be more consistent than trying to fix everything from just one side. Among the most well-known supplements for joint support, the combination of glucosamine and chondroitin is one of the most studied. It's not a miracle. It doesn't rebuild the joint on its own, and it doesn't replace proper treatment. But in some cases, it can work as an extra layer of support within a more complete strategy. The mistake is thinking a capsule will solve everything without changing movement. The right approach is understanding that, when properly used, it's support, not a standalone solution. In terms of nutrition, one of the most interesting examples is bone broth. And the reason is simple. It's naturally rich in collagen and amino acids that are part of joint tissue structure. Again, this doesn't mean you can just drink bone broth and expect your knee to fix itself. The point is this: when you improve the overall environment of your body, you also support joint health. So think of it this way. Exercise remains the foundation because it improves control, strength, and load distribution. Nutrition helps by giving your body better conditions to sustain that process. And supplementation, when properly guided, can be a useful addition in some cases. When you combine these 3 pillars, movement, stability, and nutritional support, the body tends to respond better. Now, an important note. If you notice that the pain isn't improving, if it's getting worse, or if it comes with swelling, instability, or any other unusual symptom, the best thing to do is seek evaluation from a doctor or physiotherapist. Each case has its own particularities, and individualized guidance makes a big difference. And if this video helped you, subscribe to the channel. That really helps me keep bringing this kind of content to people who want to move better and stay healthy after their 50s and 60s. See you in the next video.